Welcome to the National Single Payer. My name is Ed Gristar. I'm from Pittsburgh, Pennsylvania. National Single Payer is a national grassroots organization that organizes locally in the struggle for a national single payer healthcare system. We believe we need to rebuild the people's movement for national single payer. We're united by the common principles that healthcare is a human right, must be free of corporate profits, and must be achieved through national legislation. If you'd like to support our work, please donate to our organization. We will periodically drop a link in the chat that you can click and donate throughout tonight's event. In a few ground rules before we get started, please introduce yourself in the chat, with your name and city. Use the chat for introductions only. And please be respectful for other people's points of view. We are here to convince, persuade, and debate, not to attack. Use the Q&A function to post your questions to our speakers, not the chat. Our guest speakers will speak for about a total of 45 minutes, after which Dr. Judy Albert will ask questions posted in the Q&A. We'll try to get to as many questions as possible, after which Dr. Albert will ask for the end of the questions. Now I'm going to turn it over to Anna Malinow to introduce our guest speakers.
Thank you, Ed. As Ed mentioned, my name is Anna Malinow. I'm a steering committee member of the National Single Payer. It's my pleasure to introduce tonight's speakers, Suzanne Gordon and Bruce Carruthers. Bruce is going to be speaking first. Bruce Carruthers is an Army Vietnam vet and former adjunct instructor. He retired from the VA Senior Executive Service after a 30-year career. Bruce spent half of his career in human resources and the other half in hospital management. So when he's talking about the VA, he knows what he's talking about. He serves on the Veterans for Peace, Save Our VA National Campaign Steering Committee, and of course we're going to be hearing a lot about that, and is the past president of the Asheville, North Carolina's Veterans for Peace chapter. Suzanne Gordon is a senior policy analyst at the Veterans Health Policy Institute and an award-winning journalist and author. Her publications are too long to list, but suffice it to say she has written for our nation's top newspapers, including the New York Times and the LA Times, as well as in top journals such as The Atlantic and JAMA. She is the author, editor, or co-author of 21 books, including Wounds of War, How the VA Delivers Health, Healing, and Hope to the Nation's Veterans, and The Battle for the Veterans Healthcare, Dispatches from the Front Lines of Policymaking. And I also have this, which is a highly recommended book called Our Veterans, Winners, Losers, Friends, and Enemies on the New Terrain of Veterans Affairs. Beyond being an expert on VA healthcare, Suzanne is also a playwright. She wrote the play Bedside Manners about how doctors and nurses communicate or fail to do so. She is the co-editor of the Culture and Politics of Healthcare Work series at Cornell University Press. She's also an outstanding cook. There is nothing that she can't do, and everything she does brilliantly. As a result of her common touch points, we have become good friends, someone I can trust to keep me as honest as she possibly can. So Bruce and Suzanne will be talking about how privatizing the VA is threatening the one publicly financed and publicly delivered healthcare system in the US through outsourcing, which is the referral of veterans in the VA to non-VA private sector community care, something that in the past was made infrequently and for very rare reasons. This outsourcing accelerated in 2014 through the Choice Act and into warp speed in 2018 through the Mission Act. They will be discussing the Red Team report. That is a term utilized by governmental agencies that refers to a small group of persons authorized to review and recommend options that should be taken to address a problematic situation, such as the outsourcing of the VA, which the authors called an existential threat. They will let us know who other than us is listening to the report and why saving the VA matters. It's my sincere pleasure to introduce Bruce Carruthers first and then Suzanne Gordon.
Hi, and thank you, Anna, for the introduction. I should also mention with Suzanne, I serve on the steering committee of the Veterans Healthcare Policy Institute. What I want to talk about first is what the VA actually does, and the VA consists of three administrations. There's the Benefit Administration, Memorial Services, and then the Veterans Health Administration, or VHA. So throughout the presentation, Suzanne and I may well refer to VHA, and that refers to the VA healthcare system, its hospital system. It is, in my impression and in my experience, few people outside of those who work for the VA or some veterans who are served by the VA have any idea of the depth and the scope of what the VA does. Many people think it's just a VA hospital someplace that takes care of primarily old veterans. But in fact, that's not the case. It's a vigorous institution that's an essential part of the American healthcare system. The VA has four missions. Its first mission, obviously, is healthcare for veterans. But its other three missions are education, research, and national preparedness. So if we talk about healthcare, VHA, the Veterans Healthcare Administration, is the largest integrated healthcare system in the country. It provides care at 1,321 facilities throughout the country. That includes hospitals, outpatient clinics, vet centers. It's a very large institution and provides care for that. It serves 9 million enrolled veterans. The VA in its healthcare takes a holistic approach, unlike the fragmented approach that the private sector takes. That is, if you're enrolled in VA care, and I get my health care at the VA Asheville, you have a primary care provider who's part of a team who coordinates your care, coordinates all of your care, not just specialty or primary care. That is care for your physical problems, your mental problems, your social problems. And so there's a team that treats you, and that team coordinates your activities. So on the team will be a nurse, a pharmacist, physicians, and your primary care doctor always knows what the issues are and refers you to a specialist if you need, and then you come back to your primary care doctor. To some extent, you do that in the private sector, but when your primary care doctor refers you to a specialist, you're gone from him. When the VA primary care doctor refers you to a specialist, you're still in the same institution, and you're still part of that team and that network. And you can go in for a medical problem, and if a social or psychological problem emerges, you'll be referred to the appropriate person, and the primary care provider will still be that. When you see a provider in the private sector, they're interested in one problem. So you have a bad knee, you see an orthopedic, and that's the only thing that person is concerned with. In the VA, they're concerned with you as a person, as a whole person. And that's a real difference between the VA and the private sector. And I've had experience in both the VA and in the private sector. It was the first and the only healthcare system in the country with a fully electronic medical record. If you're a veteran, so if I'm a veteran in Asheville and I go on vacation in San Diego to see my son and I get sick, and I go to the VA hospital in San Diego, my entire medical record is available to any practitioner there because it's a nationwide system. The VA tends to get a bad rap in the paper. It's an easy target, and if the VA does something good, that'll be on the last page. If there's a scandal at the VA, it'll be on the first page. The VA is a large organization, and obviously it has problems, but the difference in the problems with the VA is that the press likes to pick up on them, and the VA is a transparent organization. You can enroll in the VA's Inspector General website, and you can get weekly reports on reviews they do of medical centers and outpatient clinics. So at least every week you'll get one review. The Inspector General does a review, they publish it, the facility has to respond to corrective items, and those will be followed up on. That doesn't happen anyplace else. Where I live, Hospital Corporation of America took over the regional medical center, Mission Hospital, and they have had nothing but problems. In fact, they were under warning from Medicare because of failures in the emergency room, and the nurses at Mission Hospital unionized. It's a difficult thing to do in North Carolina. So it's a very transparent organization, and so it gets a bad press. But in fact, There are numerous studies that show that VA care is equal to and often superior to private quality care, private sector care, and more cost effective. And at some point, I think Anna's going to put in the chat a link to Veterans Healthcare Policy Institute. If you go there and you go under our work, the tab our work, and then look at why VA matters, you can see a list of peer-reviewed studies. There's a summary of each study and a link to the study itself. And you will see continuously there are studies that show the VA provides equal and often superior quality care. And Suzanne may talk of some of the examples later on, but there have been studies in emergency room care, there have been studies in orthopedics and prosthetic care, in women's veterans care especially, that shows the VA provides a higher quality care than the private sector. In terms of how veterans feel about the VA, according to Medicare's latest national survey of patients, VA hospitals outperform non-VA hospitals on all 10 core patient satisfaction metrics, including overall hospital rating, communication with doctors, communication about medications, willingness to recommend the hospital to other veterans, and more. In April of 2024, the VA released its latest patient satisfaction survey, and they've been doing that since 2018. Patient satisfaction, veteran patient satisfaction with the VA facility is at 91.8%, up from 85.6% in 2018 when they started doing these surveys. I would challenge any corporate healthcare system to match those kind of figures, to match the Medicare patient satisfaction figures or the VA veteran satisfaction figures. So what often happens in the press is one veteran complains about his or her care, and that's a thing the press focuses on. They don't focus on the immense satisfaction the veterans have with their care. I get my care at the VA Asheville, and I don't want to go on a whole lot about it, but in the last couple of years, I've had gallbladder surgery and prostate surgery. Both of them were very satisfactory, and for the prostate surgery, I'm still being followed with that. It's hard to describe what it's like when you go into a VA hospital. So one time I went in, I saw the primary care provider. I complained about a pain in my back. I got an MRI, and the nurse asked me if I'd had the shingles vaccine yet. I said I hadn't, so I got the shingles vaccine, and that was all in one visit. I didn't have to make any additional appointments. That was all taken care of in this kind of holistic approach. The second mission is education. The VA, some 13,000 hospitals and clinics are key training ground for many of the nation's future doctors, nurses, and other clinicians. Over 1,800 or 90% of educational institutions partner with VHA in a $900 million a year training program. More than 70% of the nation's physicians receive training at VA facilities. So anytime you see a doctor, it's very likely that he or she has had some training at a VA facility. The American Association of Medical Colleges recently told Congress, and this is a quote, "The VA is an irreplaceable component of U.S. medical education and research enterprises." The third mission is research, and this is something that very few people understand about the VA. VHA is second only to the National Institutes of Health in the scope and impact of its research. That's how large its research program is. I worked at several highly affiliated institutions, that is, medical centers that are near or on the grounds of a school of medicine, and they have joint research programs. So I worked at the Birmingham Hospital, at the Colorado Hospital, at the Lexington, Kentucky Hospital. Some of the things that have been the result of VA research are the shingles vaccine, the nicotine patch, the implantable cardiac pacemaker, and the use of beta blockers. In addition, what is currently, in terms of some research going on, the VA has what's called a Million Veterans Study. It's a longitudinal study of 1 million veterans, so it has a huge database and is able to track these veterans with certain diseases over time. A good example is prostate cancer, particularly among Black veterans, since that's so prevalent. And since VA patients are long-term patients, they don't go from one insurance company to another. They can be tracked over the long term. The last mission is a national preparedness. So in a time of emergency, any kind of national emergency, terrorism, storms, the VA serves as a backup to the private healthcare system. During the COVID pandemic, for example, the VA provided equipment and nurses to private hospitals to help treat patients. The fundamental point I'm trying to make here is that I don't believe most people realize how essential the VA is to America's healthcare system. If it disappears, we won't have the same research program we had. We certainly won't have the same sort of education of physicians and nurses and other healthcare practitioners. And I'm sure all of you know as well as I do the projected shortage of physicians and nurses and other healthcare providers in this country. We can't afford to give up anybody who is training healthcare providers. Privatization threatens to undermine and eventually destroy VHA in all these things that it provides for that. And the research program, education program doesn't just benefit veterans, it benefits all Americans. One other example of research is prosthetics. Since we have so many war-injured wounds, many of the prosthetic advances that we've had in this country have come from VA research. I want to make just one more point and then I'll turn it over to Suzanne. We talk about, sometimes people say, well, if we had, for example, Medicare for all, we wouldn't need the VA anymore. But in fact, what could happen under Medicare for all, which to me would just be a beginning step in healthcare reform, would be any veteran could use his Medicare treatment at the VA, and he'd get the same kind of comprehensive health care I get. Decades ago, the Tuskegee Hospital in Alabama did an experiment where any veteran over 65 with Medicare could get his or her treatment at that VA facility. The VA treated those people without charging a copay or deductible, and the VA actually made money on that in the sense that the reimbursement was greater than the VA's cost. Well, as soon as the medical staff heard about that, they put a quick end to it. The initial idea was to expand it if it worked, but it came to an end. But it certainly could work again, and if we expand healthcare for all, the VA could start treating veterans' families, veterans' dependents. So if you have questions about the VA and what it does, I'll be happy to answer that in the Q&A session, but I'm going to turn it over to Suzanne now.
Thank you so much. And, you know, Bruce is so invaluable because he's not only, he's had so many perspectives on the VA because he's had it as a patient now and also working there. And I think that's kind of a very interesting and invaluable perspective. I mean, what Bruce outlined, I think, and I just really want to emphasize this, I've kind of having spent about 15 years studying VA care and watching it and really wishing I could get the kind of care that veterans get. And one of the things, you know, Bruce didn't say, which I think is kind of important for this discussion, is that most Americans assume that all veterans have access to VA healthcare and benefits, and that's not the case. Your access to healthcare and benefits depends on your discharge status from the military. I don't want to get into that now, but it's a kind of a disgusting scandal that most people don't know about, is that the military often punishes veteran service members who have mental health or physical health problems and therefore act out in certain ways that they don't like, and they get rid of them with a discharge status that makes it impossible for them to get VA benefits, either healthcare or healthcare and the GI Bill. And there's about 1.2 million vets that are subject to that. But so, you know, their ability to get VA healthcare is dependent on their discharge status, and also if they have a provable medical problem or mental health problem that was acquired or exacerbated by by military service, and that's often very hard to prove because 18 to 20-year-olds, when they sprain their knee or their ankle jumping out of a helicopter, they're macho and they don't go to the medic or to the doctor, and they don't have a paper trail, and particularly if they have a mental health problem, they really don't go. So a lot of people don't have a paper trail to prove that they have some kind of disability and can therefore get a rating. And the other thing that can get you into VA is having a high income. So it's pretty interesting because not all vets, like my colleague Ken Kaiser, who I'll talk about later, he developed the modern VA. He can't get care at the VA that he created because his income is too high and he doesn't have a service-connected disability. I mean, it's like this huge irony. The other irony is that non-veterans who are caregivers at the VA, there's about 400,000 people who work at the VA, and a third of them are vets. But the people who work and give care to veterans and help, refine and innovate care models of care that are so amazing and that have these incredible outcomes, they can get care in their own institution because they aren't veterans. And that we'll talk about this later when we talk about expanding VA, but it's kind of an interesting, it's an interesting irony. And I think, what Bruce described is in my view, and I've really come to this conclusion, I believe that the VA healthcare system is in fact not only the only publicly funded national healthcare system in the United States, but is the only healthcare system in the United States. Because we have, as everybody on this call I think would agree, we have a disease treatment system and it's broken. It doesn't do a very good job at that, but it doesn't do healthcare. I mean, the VA does mental health care and physical health care. It deals with homelessness. It has veterans legal programs. It deals with vocational rehab, deals with economic problems. I've attended cooking lessons at the VA. In one facility, they were giving Iraq and Afghanistan vets salsa dancing lessons. I described this to a Republican congressman, and he got, salsa dancing? What does that have to do with healthcare? And I said, well, if you're an Iraq and Afghanistan vet and you don't want to go near anybody, salsa dancing is kind of like a good way to re-socialize you. Plus, it's fun. God forbid. There's a sense of community at the VA. I've never been in a healthcare system where people actually in the cafeteria or the waiting rooms talk to each other. Like, imagine that, and there's a sense of community there. And people are treated in a system that's mission driven, but it's not profit driven. I mean, everybody in VA is on salary. There's no incentive in the VA to do too much or too little. We'll see this. I can present this study. For example, when vets go through the new private system to private sector providers for prostate cancer that, like Bruce had, and as folks may know or not, prostate cancer is the biggest cancer affecting veterans, not just because it's primarily, something like 90% of patients in the VA are male, but because prostate cancer was a big problem because of Agent Orange in the Vietnam War. And the VA is, according to one study that was recently done, the only healthcare system in the country that actually applies the standard of care for clinically insignificant prostate cancer, which is watchful waiting. So when vets or other patients are sent with, low risk prostate cancer to oncologists, often they get unnecessary radical prostatectomies or invasive radiation treatment. And the VA there, because there's no incentive, to give unnecessary treatment because it's not a fee-for-service system. people like Bruce will get, I believe what you're getting, Bruce, which is watchful waiting. And, I mean, this is like a big patient safety issue because it's a total violation of patient safety to cut people up for no reason. And all of these, I mean, there are many, many doctors and physicians and nurses and so forth on this call. And that, you don't want there's no free lunch with these kinds of medical interventions. So I think it's really important for folks to understand that this is really our only healthcare system, and I say that advisedly because we don't have one in the private sector. We have a medical treatment system which doesn't work very well, even doing medical treatment, but it doesn't deal with healthcare. VA is the only system that deals with social determinants of health. It's a population-based system. They've just done another study comparing private sector care to VA care and showed that the VA is better on health equity measures. Like, for example, when COVID happened, there were fewer African-American deaths due to COVID, like they were in the private sector. And one could go on and on on the issue of equity. I mean, all kinds of hospital systems have, equity departments and equity this and equity reports, but the VA actually does it. So I think it's important to contextualize that because I think, Bruce and I, where we're going to come out at the end of our presentations is advocating that the VA is a model of care that should be our North Star in this country. When we're fighting for national health care, Medicare for all, it's an example of a government program that works, which is why it's being attacked so heavily by the right, because you're not allowed to have a government program in this country that competes and wins against the private sector. That's the cardinal rule of American capitalism. And VA has consistently violated the rule. And so that's why there are these efforts to privatize it. And Bruce mentioned the Choice Admission Act, and what's basically I'm going to talk about is the efforts to privatize it, which is actually really important for those on this call, because when Congress in 2014 passed the VA Choice Act, and when it then followed in 2018 with the VA Mission Act, it did something it really didn't intend to do. What it did was it set up in the Choice Act, and I'm going to really skip over that. It allowed vets to go to private sector doctors at the government expense if they lived too far or had too many delays in getting care at the VA. The Choice Act was a compromise with a long history between Bernie Sanders and John McCain. It was supposed to be temporary. It was supposed to provide the VA with needed money to hire staff and do some improvements. And basically, it was going to sunset after 3 years. And that's why Sanders supported it. And John McCain turned around after Choice was passed, and they started this processing of outsourcing VA care to the private sector. And McCain said, whoops, I really didn't mean it, and they introduced under Trump this VA Mission Act of 2018, which set up what is called the Veterans Community Care Program, which is a parallel private sector program to which veterans can go if they, under certain conditions. The Choice Act was passed, and this is really important, both the Choice and the Mission Act, but particularly the Mission Act, was passed because it was supposed to provide high quality care in a more timely fashion that was more conveniently located than the VA. And the Trump's VA secretary set up these access standards, which said what vet could have access to private sector care. And he set standards that were so almost impossible to meet for the VA that guaranteed a flood of people being outsourced to the private sector. And it basically, the rule was if you had to wait for more than 20 days for a mental health or primary care appointment, or wait more than 28 days for specialty care, you could go to the private sector. And if you had to drive more than 30 minutes for primary care, mental health care, or more than 60 minutes to specialty care, you had to, you could go to the private sector. So this setup, I mean, in rural America, everybody is pretty much eligible for private sector care under the Mission Act, because it's very rare that you can live in rural America and drive less than 30 minutes or 60 minutes for an appointment. But it's also true in urban areas. So this opened the floodgates. And so basically, what we saw was that they set up this private network. So the VA now runs two parallel systems. One is an insurance company that pays for care that other people provide, and that, by the way, the VA is supposed to be able to coordinate, even though there is no requirement that private sector providers provide them with the means to coordinate. And people don't coordinate care in the private sector. In the private sector, physicians aren't, given a special CPT code that they can use to bill for coordinating with a VHA provider. So there's no coordination of care. The integrated care that the VA provides is now fragmented because the vet is going here, there, and everywhere, and then to the VA. There is no requirement that private sector providers have any expertise or training, as VA providers do, in veterans' complex healthcare conditions. And Bruce can talk about this at length. Vets have very specific healthcare problems. I mean, I once talked to a friend of mine who was a Vietnam vet recently, and he had gone to some private sector provider, and he was complaining of insomnia and nightmares. And actually, the private sector provider didn't even know he was a veteran. The billers knew he was a veteran. And he was prescribed Ambien, which is contraindicated for PTSD, which was the guy's problem. But the provider didn't know anything about PTSD or Vietnam vets. I mean, I'm not a doctor. I could have diagnosed the guy like in 9 seconds. And, he eventually went to the VA. But there's no requirement that private sector provider know anything about PTSD or military sexual trauma. They are, as is traditional in the private sector, given voluntary material that they can use, to get up to speed about all these complex problems like burn pit-related bronchiolitis or traumatic brain injury or whatever. But guess what? They don't avail themselves of these materials, which are given to them for free, because why should you take time out of your incredibly, overwhelmingly busy day as a primary care provider? You're not even able to keep your head above water, with your own patient load. If, if about 1% to 5% of your patient panel is vets, it makes no sense. And they aren't required to take these trainings. They're also not required to record their wait times or their quality of care or anything else. And the VHA has been hemorrhaging dollars, which was, by the way, the intent of this legislation. The intent of the legislation was written by the Koch brothers, representatives of their phony veteran service organization, the Concerned Veterans for America. It was written by Darren Selnick and Brooks Tucker and some other folks that were hard-right privatizers who were ensconced in Trump's White House and VA, and they wrote legislation that was designed to dismantle the VA by draining dollars and patients out of the VA. You cannot run two parallel healthcare systems, right? One of which has diametrically opposed priorities and imperatives than the other. And that's what's happening, is that people can't administer, they don't have the time, and the money is being drained out of the VA. The Veterans Community Care Program now takes up more than 30% of VHA clinical care dollars, something like 36 billion a year, and it's growing by 17% a year. It is draining the VA of patients. Over 6 million, about over 40 million, 40% of VA patients are going into the private sector, to 1.7 million providers. VA, any provider, on any doctor, nurse, or PT or OT or anybody on this call, imagine if you have to take care of folks in-house and then you're being asked to coordinate the care that somebody else who you don't even know, over whom you have no authority, is taking care of your patient. I mean, imagine what kind of nightmare that would be. And people are being driven crazy by this. And administrators don't know, like, what are we administrating, an insurance company or a comprehensive healthcare system? The VA commissioned in January a red team that Anna mentioned, made up of Ken Kaiser, who created the modern VA, and 5 other people, one of whom was a Bush's undersecretary, George Bush's undersecretary for health, 2 people who were involved in the privatization of the military health system, somebody, Dana Saffron, who is the CEO of the National Quality Forum, and somebody from Kaiser. And these people released this report, which I put in the chat, and it basically said, and I'll read you it, that the increasing number of veterans referred to community providers threatens to materially erode the VA's direct healthcare system, eliminating choice for the millions of veterans who prefer to use the VHA direct care system for all or part of their healthcare needs. They said that they found that veterans, 30% of the health, $36 billion that community care was spent on costs for ER care, because so many vets were going to private sector ERs. And this is really extraordinary that you would send any vet to private sector ERs, because, and I put it in the chat, a study was recently published in the British Medical Journal that analyzed something like 500,000 ambulance rides for dual eligible vets. That means they had Medicare and VA care. And it showed that veterans who went to private sector ERs had a 46% higher mortality rate than vets in the first 28 days than vets going to the VA. So you were pretty much twice as likely to die in a private sector ER, and it cost 21% more. And you know what this highlights is the thought that I sadly didn't finish when I introduced my part of the talk, is that the Mission Act actually set up a kind of gold standard random controlled trial between the private sector and the VA with veteran patients. And it has consistently shown, study after study, that the VA delivers better care than the private sector. And every single study that's come out, and it's just over and over and over again, has concluded that the VA beats the private sector. And we also have seen in the red team reported that the whole rationale for the Mission Act was to provide higher quality care, more conveniently located, and speedier to access. The care in the private sector is not speedier to access. It's much quicker to get care at the VA. The care in the private sector is not conveniently located, particularly in rural areas. And I put in a report VHPI did on rural healthcare, and you just have to go to the website. I recommend this for anybody who doesn't know about it and is interested in rural healthcare, the Rural Health Information Hub, and they have these amazing maps. Well, they're, HRSA maps, they're healthcare professional shortage area maps. And I mean, it's astonishing. There's like no care there. So basically, you have a system that isn't living up to its promises. And basically, you have these red team experts. And I want to point out that the red team, it's not only its conclusions and the data it shows, but who is on it. These are not the usual ranting suspects ranting against privatization. These people, I mean, John Perlin was the chief medical officer for Columbia HCA, the head of the second largest or first largest private healthcare hospital system in America. This Perlin is not an anti-privatizer. They had two people from the military health system who basically said, do not privatize the VA and make the same mistake that we did that we are not trying to reverse. So I think that what we've seen, and then the other thing that the red team report documented was it had 30 recommendations for what could be done. And one of the things that I forgot to mention this, is that the hemorrhaging of funds and patients from the VHA has created such a disastrous situation that the VA now faces a $4 to $5 billion budget deficit. They've had to initiate a hiring freeze, which they refuse to say is a real hiring freeze. And their budget request for 2025 was cutting 10,000 positions and another 10,000 positions cut in 2026 because they can't afford to run two parallel healthcare systems or healthcare enterprises at the same time. So we're facing in VA a $4 to $5 billion budget deficit. The red team report made 5 or 6 out of 30 recommendations would save the VA $23 billion a year. Now, that has completely freaked out the Republicans. And I have in my hands here somewhere, this amazing letter that Senators Jerry Moran and 19 other Republican senators sent to McDonough, basically saying to him, you have to ignore the red team report. This was total nonsense. These people weren't independent and you're rushing ahead with its recommendations. In fact, he is doing precisely the opposite. He's tried to conceal the report and downplay it. And they're like completely freaked out that they're going to try to bring patients back to the VA and, not support and promote the private sector system. So really, I think speaking for both Bruce and I, we think healthcare reform activists like yourselves, it would be so super if you could join in the struggle against VA privatization, understand what an amazing healthcare system, our only healthcare system, the VA is, and try to fight for expanding rather than dismantling the VA. We can talk about how that could be done. Bruce and I talk a lot about VA for all. I favor that rather than Medicare for all, because I think we really need a national healthcare system that provides and pays for care rather than a system that just pays for care. And we think that, you don't need to go to Taiwan or Canada or Scandinavia or France or Germany or wherever, practically anywhere else, to find a functioning example of a government-run healthcare system. You just have to go around the corner in some places or, to the next city and see how it works. And that's why they want to kill it, because it works. And we feel that we cannot afford to allow this to happen. If a Democrat gets in, and God help us, please, we need to really focus on rectifying all the bad things that the Biden administration did to continue the Trump era agenda. And if obviously a Trump gets in, boy, that's going to be really a disaster, because he just wants to completely privatize the VA. So, you know, we hope that maybe some folks in National Single Payer will be interested in forming some kind of VA for all or VA committee. And I by the way, I want to make it clear that when we say VA for all, we do not mean that 330 Americans descend on 170 VA medical centers. We mean that VA is expanded to cover all veterans and their families and as a population-based system, but that the VA's model of comprehensive healthcare could serve as a model or a starting point, a scaling up point for the rest of America. So we hope folks will be interested in maybe forming some kind of committee or working with us. I mean, we're already working with Anna and so many of you informally. And also we have a letter that folks could send out about the Red Team and about VA privatization, and that would be enormously helpful as well. So thank you so much. I hope I didn't go over my time. And I want to thank my colleague and friend Bruce for presenting with me, and thanking all of you for giving us an opportunity to talk with you tonight.
Well, thank you so much, both Bruce and Suzanne, for explaining the benefits from the VA and what's gone on. It's confusing because I think what Bruce said is absolutely true. The media presents the negatives and we don't hear the positives. And the system that they set up with the choice followed by the mission acts, I think is quite interesting, the way Suzanne presented it as a randomized controlled study, which we could really capitalize on to try to get that message out. So I do have a number of questions that I would like to get to. Some are specifics to the VA and how it functions, and some are more policy oriented. But the first one of the attendees would like to know, if you are getting your care from the VA, can you choose your primary care specialist, your primary care doctor, and or your specialist from various VA doctors?
Well, you can, if you will be assigned to a primary care provider. Just like if you're not happy with that person, you can request to be changed. It's the same thing. I mean, that person will refer you to whatever specialist is available. If you're not happy with it, you can request a change, but it's not, you can't go shopping. You can't say, well, I want this doctor this week and I want that doctor next week. That's pretty similar to as it is in the private sector.
Okay, great, thanks. And with the system as self-contained as it is, you don't have to go, across the street to the other health system because you don't like this, because everything is all contained there. So,
well, if
okay.
I could make one more short comment about that. So, before the Mission Act and the Choice Act, the VA always had what were called fee-based doctors. So, for example, I worked at the Erie, Pennsylvania hospital, which is like a small community hospital. And it didn't make any sense to have all the specialists on staff. So we hired people from the community who actually came to the VA, certain clinics. Maybe every Wednesday afternoon they'd have a clinic and they would be paid for it. So the VA has always relied on outside providers if it didn't make sense to have that specialty. But one of the things that maybe we didn't mention enough, or Suzanne didn't mention enough, VA doctors go through an extensive vetting procedure called credentialing. I mean, it's not done in a day. It takes a long time to really credential them. Doctors in the Veterans Community Care Program, the only credentialing goes on there is they have a license. That's about it. So nobody really knows anything about them. The care of VA doctors is reviewed on a regular basis by the VA, by the Inspector General. That doesn't happen in the private sector. So it's just a much different situation. And the system that the VA had before worked perfectly well. There really wasn't any reason for the choice or the Mission Act.
Mhm. Well, that actually does lead to another question. How can you compare the salary to VA staff with the reimbursement that staff would get from private health insurance? I think it's a little bit complicated, but maybe.
It depends on the specialty.
Mhm.
So for some specialties, you know, an open heart surgeon, for example, can probably make a lot more money in the private sector than he or she can in that. But the VA has two advantages that when we were recruiting physicians, there were two things that really attracted them. First was the opportunity to practice medicine, the way they were taught and the way they wanted to. Not having, I recently spoke to a doctor who used to be my primary care provider. I at some time in the past, I got a higher level service connection, so I was eligible for complete care at the VA. Before that, this doctor, and he told me, he said, it used to be I could spend as much time with my patients as I wanted, and if we had a good year, we gave a bonus to our staff. Now, all this is pressure to see patients day in and day out, and he's going to retire because they've been bought by a corporation. So doctors can come in, they can practice medicine they want, they don't have to order a necessary test, they can spend time with the patients. There are 3 points. The second point is they don't have to have malpractice insurance. The government provides it, which was a big draw. The third one is for highly skilled physicians, many of them are also interested in research. So they get a joint appointment at a VA facility and at a medical center. They get to see patients, both VA patients and patients who come to the College of Medicine's hospital, and they get an opportunity to research, and they get grants from the VA, they get grants from the Institutes of Health and from other sources. So those are people who are really attracted to high quality medicine and research, and the VA offers them an environment they can't get in the private sector. So generally speaking, and their specialty pay for people in rare specialties. So the VA, I think, all things considered, the VA competes very well with the private sector.
Suzanne,
I
please.
I just want to add that, you know, I mean, so many physicians and certainly primary care providers and nurses are burned out because of the way that our private sector system works. And the VA, they have smaller patient panels. The 10-minute visit is unknown. And what I observed was really a community of care. I mean, they, among providers and nurses and support staff, they have teams. They have genuine teamwork. And, you know, having studied teamwork and studied medicine, what's going on now, people may be making a lot of money in some specialties, but they are just at their wits' end, and they have no support. They don't support each other. You know, it's like becoming a Midas muffler shop. And in the VA, when it's well funded and staffed, it's a totally different model. And the other thing is that has to be said, there is no administrator or medical director or visit director or anyone in the VA who makes, you know, $1 million or $18 million a year as a salary. Your tax dollars, I mean, most folks aren't allowed to earn more than the president. So the secretary of the VA, you know, who's running, I mean, a huge national bureaucracy, you know, what is it, Tyson and Kaiser makes $18 million a year. You know, the secretary of the VA probably makes less than $400,000. So if we want our money to go to healthcare as opposed to administrative salaries and all this nonsense, I mean, you know, this is the place to look at.
Some more questions about the staffing at the VA. Does the VA employ enough health professionals to cover the needs of their patients? Excuse me, this is a multi-part question. How long are the waiting lists for commonly used services at the VA? Are there enough case managers to serve the VA patients? particularly in longer-term patients. So,
Yeah, I think I can add, and maybe Bruce can. So essentially, staffing has been a problem because they've understaffed, but even with understaffing, they have better staffing than in the private sector. The wait times are shorter than in the private sector. I mean, I'll give you an example. My husband had been having some really serious pulmonary problems, and he got an appointment with a pulmonologist in his health system in Northern California. He had to wait 4 months, and then 2 weeks before the appointment, he was informed that the guy had left the practice, and now he has to wait another 5 months. He wanted to get a urology appointment to manage benign prostatic hypertrophy. He had to wait 4 months because the urologists saved their appointments for patients for surgery because that makes more money. He would have gotten his appointment in 2 weeks in the VA, probably 4 weeks in the VA for the pulmonologist. As I said, we know that the wait times, the private sector does have measure wait times. Merritt Hawkins every 2 years conducts a wait time study in 15 markets. VA is the only system that measures wait times, so wait times in the VA are shorter. Case managers, that's a really interesting question. The VA has coordination of care. I mean, Bruce may want to talk about this. They don't have, in the private sector, case managers are get you out of the system managers or money managers. They don't have real case management. In the VA, they have teams of people that are case managers. A friend of mine, a couple years ago, her husband was under Kaiser. He was 87, and he had very severe COPD and dementia. Kaiser would not give her a hospital bed for her husband unless he was on hospice, and would not give her the meds used to adequately manage the COPD, so he had to come into the ER every 2 weeks. I found out he had been an Army veteran. We got him into the VA. I found my favorite primary care doctor, and she had an opening. They saw him right away, but my friend, the primary care doctor, said, "Oh no, he shouldn't be seen in the primary clinic. He should be seen in the geriatric primary clinics." Kaiser has one geriatrician in Northern California. We have 7,600 geriatricians in America to serve 33 million people over 65. The VA has geriatric primary care, geriatric home health care. The long-term care, they have better staffing in their nursing homes, less churn. In fact, because the situation under COVID was so disastrous in nursing homes, the VA was asked to take over some nursing homes, particularly veterans homes that were run by private for-profit companies. So they have way better long-term care than the private sector. Are there problems in the VA? Yes, particularly since the Mission Act and so in my view, and I wrote about this in Wounds of War, you had this amazing dual healthcare system, amazing. And you're not allowed to have an amazing healthcare system in America that's public. And so the right wing has set about attacking this system. They have influenced the media coverage. I mean, it's amazing to me that, folks who don't believe, a lot of my progressive and liberal friends who don't believe anything people would say about Medicare or Social Security or public schools will buy the propaganda about the VA, and it's really sad, which is why all of us, I think, have to educate people, because this is propaganda that is being fed to the media, and they are broadcasting that propaganda out to the American public.
Can I just, to add to what Suzanne said, I think, generally speaking, the VA has adequate staff to deal with them. It depends somewhat by region. A lot of veterans have moved to the Southeast and the Southwest, and so there's more difficulty there. But especially since the Mission Act and Choice and Mission Act, Suzanne said about 30% of VA's resources are now being directed to the private sector, and that puts real pressure on staffing because it's not just the money that comes out of the medical services budget. It's a time that VA staff have to spend coordinating this care. If that money was directed back to the VA and it could hire providers, I think whatever issues people face would be much diminished. But still, I can tell you from personal experience, I have a much easier time getting an appointment at the VA, either with a primary care provider or with a specialist, than I had when I was going to the private sector than my wife has. I mean, it's not unusual now to wait 4 or 5 months. You need to see a specialist, and you call, if they'll even see you, that's 4 or 5 months, and you can see someone in the VA much quicker than that. Just to give you an example, the cost of these, there are 2 companies that administer the Veterans Community Care Program, Optum and TriWest. Since this program started, the amount of money diverted to them to administer this has increased by 120%, and they keep asking for more increases all the time. So PACT Act made people eligible for toxic exposure, burn pit exposure, traumatic brain injuries and the like. So of course they use that as an excuse. Well, we're going to need a lot more money to be able to administer this. I don't know what the figure is now, but when it first started, they were charging $200 or so a visit just for administrative costs. That was not to pay the physician. That was just to refer somebody to see a doctor. And I don't know what it costs in the VA. $10 is the most with administrative costs to see somebody. It's nothing like that. So I think the answer to the question is the VA is not as adequately staffed as it could be if all this money was not being diverted to the private sector, but still, in virtually all cases, you can get care at the VA faster than you can in the private sector.
Yeah, I mean, I think it's exactly the same thing we're seeing with traditional Medicare and Medicare Advantage. I'd like to move on to some questions, some specific questions about long-term care. Can you address the difficulties with getting long-term care for veterans of the Vietnam War who have only 67% liability for VA? This person gave an example of a friend who's struggling to pay for a nursing home even though they were a helicopter pilot exposed to Agent Orange in the late 1960s.
Yeah. I think you have to be 70% or above service connected to get nursing home care. And so the issue there is that is not something that the VA decides. It's a funding issue. So in order to be able to provide nursing home care to veterans who might be eligible otherwise, the budget has to be increased to provide that care. One other thing on nursing home care, for a while when I was in the VA, I went along with teams that did inspections of private nursing home cares that we contracted for veterans. And I can tell you that if you're a veteran and you're eligible for nursing care, you want to do all you can to get into a VA facility and not into a private nursing home care. But anyway, so that's true, and it should be more people are eligible, but it would take Congress to change funding for nursing home care for Vietnam veterans or any veteran.
Yeah.
Can you explain what the 67% liability means?
Well, it's service connection. So if you were injured in the service, some kind of condition, for example, I have a service connection for exposure to Agent Orange for prostate cancer and for a cardiac condition. Or it could be PTSD. It could be that you had shrapnel. It could be anything. If whatever disability you have is related to the service, you get a certain rating depending on the extent of your disability. It can be from 0 to 100%. And so 70% means that the VA has determined based on the evidence you submitted that essentially you're 70% disabled, that your life has been affected to this extent of 70%. And so that's what it's called. It's called a service connection.
And who decides the percentage? Who assigns that percentage?
The Veterans Benefit Administration, that's one of the 3 arms of that. They have adjudicators. You submit application and medical evidence. And just for anybody here, any veteran who thinks that they want to file a claim, do not listen to these people who are called claim sharks. They'll charge you money to do it. You can go to a veteran service organization, the American Legion, the Disabled American Veterans, or you can go to your county veteran service officer, get exactly the same service or better at no charge. So anybody who wants to file a claim should see an authorized representative, and that's somebody in the American Legion, the DAV, Veterans of Foreign Wars, or your county service officer.
Okay, good to know. Another sort of related question. Somebody wrote about a relative who is a resident of a VA home is entitled to care at the VA Medical Center, where they've been told all specialists except psychiatry are covered, but psychiatry is treated as rehab. And can you explain that, or is that a misunderstanding?
I don't know if Suzanne does. I'm not familiar with that. That doesn't sound, that may be a case I'm familiar with. I think the person is in a state veteran's home and can't get service at a VA facility, and I'm not sure why that is. I'm not sure what the requirements that would be.
Is there somewhere they could connect with? Go ahead, Suzanne.
It's very important to understand that is this person's relative in a state veterans home?
I don't have that information, but I'm assuming they're listening.
All right. I mean, it's hard for us to go into this kind of detail about these kind of cases.
Sure. Yeah.
I mean, state veterans homes are not there's a complicated relationship with the VA and state veterans homes, but essentially, state veterans homes are not run by the VA. So people.
Okay. I think that's good enough, and we can move on to some other questions. All right. So with the privatization acts that occurred with the choice and the mission, there are some veterans who may not want their choice to be taken away and who don't want the VA to be fully funded because of a perception and the brainwashing that goes on that makes them think that the VA, that taking the dollars back into the VA is going to make their choice worse. Do you have any suggestions for how to combat this sort of misunderstanding and go forward restoring funding for the VA?
I mean, first of all, there's a couple of things that I think need to be said. To the veteran, I would say that, there's good choices and bad choices, and we would encourage them to make the right choice, which is the VA, because it provides better care. It has expertise in the kinds of problems military veterans have, which is not true in the private sector. So I would recommend, and this is why we recommend that folks kind of get a basic understanding of what VA care provides, because you can't get that in the private sector. So to that veteran, if you were in front of me, I would say, if you want a choice, it's important to choose wisely, because you can make bad choices. Not all choices are good choices. And, the VA is the best choice. We have the data to prove it. If you don't like your doctor, you can go to another doctor. You can get care in the private sector if it's not offered in the VA. But fundamentally, I think that, we have to say to veterans, we have built for you a system that we have invested in since World War I. And, for the past 110 years or more, that system has proven itself to be an expert system in dealing with veterans' need. And what is happening because of, and most veterans, by the way, overwhelmingly say they want the VA to be expanded and improved, not dismantled. Look to ask that veteran, would you support, this parallel health system that we know doesn't deliver good care, high quality care in a timely manner and convenient, where the wait times are longer, but it's threatening to kill your healthcare system, the healthcare system we as taxpayers have built for you over the past 110 years. And we hope that you will make the right choice because the nation cannot afford to run two parallel healthcare systems for veterans. And so we will see this is what is going to happen is your choice of the VA will be eliminated and you will no longer have that health system available to you. That's what's going on now. And that's why these 6, red team participants said that this is an existential threat to the VA. I personally think, I probably shouldn't say it, but I will, that veterans are not entitled to healthcare systems. There is no healthcare system in the world that allows you to go to out of network without paying for it out of pocket. And I think if veterans want to have a system that is going to kill the primary healthcare system, and so they can have their choice, a choice that, by the way, none of us have, none of us on this call have, that there should be financial penalties because you can't afford, if you were the Marriott and people, reserved a room in the Marriott and you showed up and they said, oh, hi, we're the Marriott, we're happy to see you. Would you rather go over to the Omni or, the Hilton or the Four Seasons? And by the way, you can come tomorrow for the buffet, which will fully stock for you, even though we don't know if you're going to come. I mean, it's crazy. Bruce I'm not a dollars person, but you can't, Dennis McDonough, who's the Secretary of the VA, talks about a healthy competition with the private sector, but no sports team would set up a rival team, pay you to go to, pay for the tickets for you to go to that team on the night that they were playing, pay for the players on that team. It's a Saturday Night Live skit if it weren't so tragic,
Yeah.
Can I just add one thing here? What I've said to people that is increasingly unpopular in today's environment is that we should have a community spirit. So what the VA does is provide excellent care for veterans who are eligible. More should be, but provides excellent care. So if it's destroyed, you might feel a bit better, but you are destroying a system that serves millions of people who answer the call to duty. So today, to tell people you need a community spirit is often unpopular. It's the idea, I want what I want, I don't care what everybody else gets. But I think that is a good reason to say, to give a choice and destroy the VA is going to hurt millions of veterans. And we don't seem to be able to get out of our forever wars, so we keep producing more veterans.
Yeah.
That would be an answer I try to give anyway.
Yeah. Well, I think that the information that you've given us about the Red Team report is so enlightening. And I guess the final question, if you could quickly answer, do you think the Red Team report goes far enough? And what can we do to publicize that information?
Well, I'll answer and then I'll throw it over to Bruce. Obviously, it could go way further. They didn't say repeal the Mission Act. They didn't say get rid of Veterans Community Care. They were very judicious to say that they weren't opposed to people, going to the. I refuse to call it the program. It should be called the corporate care program, but or the corporate money program, but whatever. I think that, what we need to do is return to what Bruce described, which is the judicious use of what was called fee-based care, using it when it's needed. I think we have to also really explain to rural veterans, as we tried to do in our report on rural veterans, that this doesn't solve their problems, and that actually the VA is probably the only system that could solve rural veterans' problems because it's the only public system that could be convinced to put money into money-losing care, which is what is true in rural areas. But I think that it's really important to talk about implementing these critical red team recommendations and saving. We have, as I said, a $4 to $5 billion deficit. And here's a way that you can save $23 billion a year, even if you just did half. Even if you repatriated 30% of 15% of ER care instead of 30, and that's what these guys in the Senate are freaked out. So when Jerry Moran and his pals, Chuck Grassley and so forth, start hammering the drums about how terrible the red team report is, I go, wow, the red team report must be right. So clearly we need to do what they say. You can read this letter and do exactly the opposite of what they suggest. They're terrified that this message is going to get out to veterans, and they're terrified of giving veterans information about the quality of private sector care, because they're terrified that they'll choose the VA. Because veterans can be, they can try to brainwash veterans on Fox News, but if you talk to a veteran, what's really interesting about what the media has done, it's often convinced veterans that somebody else's VA is terrible, but their VA is great.
Mm-hmm.
And so I think that we all need to just counter the propaganda and talk it up and try to get. I really want the Democrats to win in November, not just because of Trump, but I want us to be able to go to the Democrats and say, stop following the Trump plan for the VA, reverse what he did. You owe us, we got you elected, knock on wood. And that's another thing that we need to be prepared for, I think, as activists, is what are we going to do if the Democrats win around Medicare Advantage, around healthcare, around prescription drugs, around VA. All the people I know in a lot of places, particularly in unions, are like, oh my God, the sky's falling. And the sky could fall, but also it could not fall. And then what's our project, 2025, the right-wing project? What's our project, 2025, for the VA and for healthcare?
Exactly.
We need
exactly. Well, I think that's a great place to end. And I would like to thank both Suzanne and Bruce for their expert, valuable contributions, for all the work that they both are doing for the VHA. Just really a wonderful presentation. Everybody's asking for where they can get the copies of the video, and we'll hope to help use this far and wide. I'm going to pass to Claire Cohen, Dr. Claire Cohen now, and she can start the wrap up.
Okay. Hi, I'm Dr. Claire Cohen, and first of all, I want to thank you, Suzanne Gordon and Bruce Brothers, for a very informative and very, very interesting talk. Hopefully you have me convinced, and hopefully you have others convinced about the importance of the VA. And thank you to everyone who joined our presentation tonight. We have a great announcement tonight, and that is that we are launching a new national single payer website. It's fantastic. You got to look at this website. It's real high tech. A lot of interaction. Please visit it and send us your comments. And if you'd like to donate to our work, please donate to National Single Payer. Use the link in the chat to donate. National Single Payer offers educational webinars or primers every month. Sign up for our email alerts at nationalsinglepayer.com. All one word, nationalsinglepayer.com. And receive the links to register for our webinars and primers, and also to get links to previous webinars and primers. Thanks again for being here, and hope to see you at our next working group meeting, July 24th at 5 p.m. Pacific Time, 8 p.m. Eastern Time, and then at our next primer on August 14th, when we're going to learn about value-based schemes coming out of CMMI and CMS, that's the Center for Medicare and Medicaid Innovation, and the Center for Medicare Services, like ACO REACH, and other programs that are threatening to privatize traditional Medicare. Please remember to check our new website and register for our events there. And thank you, everybody, for attending. Let other people know, and bring other folk with you next time for our next primer or webinar on August 15th.